My name is Heather Beth Johnson. I'm excited to speak with you briefly today about the topic of my capstone project for my post-professional occupational therapy doctorate degree, which is compassion fatigue in occupational therapy professionals. As we all know, many patients that we treat have experienced some sort of trauma or distress. While we're treating those patients, we provide them with empathy and compassion, and that can oftentimes lead to emotional strain, which may end up resulting in compassion fatigue if the healthcare practitioner is not aware of how to cope with that emotional strain. So compassion fatigue is a term that was first used by Carla Joinson in 1992 in reference to nurses who were experiencing burnout and had lost the ability to nurture their patients. So compassion fatigue is also known as the cost of caring, or is a decrease in a person's capacity to demonstrate empathy towards their clients due to the distress and trauma they've experienced. There's burnout, which is a more common idea or a more common concept in occupational therapy. And burnout typically results in anger, irritation, negativity towards others, whereas compassion fatigue results in an unhappiness, an avoidance of patients, a detachment from patients, and even possibly nightmares. One thing that I've discovered in my research is that although there is a plethora of research in the fields of nursing and mental health, with compassion fatigue, there's very little specific research on compassion fatigue in OT professionals. The research that is out there is listed here in the section Current OT Research. One of the research studies that was done was by Chen in 2020, and that study hypothesized that compassion fatigue may be lower in OT professionals because the majority of OT professionals treat clients with chronic conditions versus patients who have experienced significant trauma. Then there was a study by Edie et al. In 2021 that showed the greater number of years working and the increased number of roles. For example, if the OT is also a fieldwork educator in addition to being a treating therapist, then that typically results in higher compassion satisfaction in that OT professional. Upon considering the impact of compassion fatigue at both the organizational and the personal level, it seems the most appropriate method to address this problem is to create a continuing education course to provide an awareness of the factors, symptoms, prevention, and treatment strategies of compassion fatigue. In that continuing education course, we will discuss a self-care plan, which should be used as a personalized toolbox that meets your individual needs. It will also offer some ideas that an organization can offer activities that will help the practitioners cope with compassion fatigue. As you can see here, there's a QR code which will link you to the references that were used for this poster presentation. And if you have any questions, feel free to contact me. My email is printed above next to my name. I hope to hear from you guys, and I hope that everyone is interested and able to take the continuing education course once it's posted.